We thought it would be valuable to look at some of the demo images on the Logic E9 where we're utilizing our strain elastography technology. In this first clinical case, we can see on the 2D image that we're seeing a mildly to markedly hypoechoic lesion that's sitting in the mammary zone and has kind of macrolobulated margins with some extension that looks like maybe there's some ductal involvement. So strain elastography is a great technology to use on this particular lesion, and you can see the region of interest is a good size. There's enough tissue around the lesion to give a good comparison. We're also seeing a very good technique in that we have a full quality bar, quality index, and the lesion is overall green in comparison to the surrounding tissue. Just a couple little flecks of blue or stiffness to it, but the majority of it being fully green. So this is your...
Here, I'll get this. You just start right over from the very beginning.
Okay.
And I'll do this, and then I'll be
okay.
out here. I'll wait for
okay. We thought it would be a good idea to look at some of the clinical cases that we have in the demo. We thought it would be a good idea to look at some of the clinical cases that we have available in the demo images on the Logic E9 utilizing our strain elastography. And so in this first case, when we're looking at the 2D image, we see a mildly to markedly hypoechoic lesion sitting just in the superficial portion of the mammary zone. And it has some macrolobulations as well as what looks like some ductal dilatation off the right side of it. So this is an excellent lesion to utilize our strain elastography. We're getting a great technique. You can see the full green quality index, quality indicator. And the technique is good in that it's uniform across the top as well as the bottom. And we would summarize this by saying that the lesion is mostly green in comparison to the surrounding tissue, so not overly soft or overly hard. Now, this is a classic appearance that we see in benign lesions. This next clinical case is actually the same lesion in another plane. So you can do elastography, let's say you're evaluating lesions in radial and anti-radial or longitudinal and transverse. You can perform the elastography in one plane and then follow it up with the elastography in the orthogonal plane. And again, we're seeing just a couple of flecks of blue or hard pattern within, but the majority of the lesion being fully green in comparison to the surrounding tissue. Another great application of elastography is if you have some dilated ducts. And because cancers start within the duct and then grow down the duct before it branches out, it can be hard to visualize these small lesions within the ductal system. So here again, we're seeing just a fully green, very uniform pattern across this entire area posterior to the nipple in this particular breast. So nothing here that's too concerning in terms of how the elastogram is measuring the stiffness. Good technique there as well. Again, here's another area posterior to the nipple. This is a very difficult area of the breast to evaluate, but again, we can use the elastography to see that we're getting a fully green pattern and very uniform pattern across the entire region of interest. In contrast is this particular clinical case where we're seeing two mildly to markedly hypoechoic lesions. One is very superficial, the other just posterior to it. If we look again at the margins, this is an angular margin. Those are typically highly suspicious for malignancy on ultrasound, as well as these lobulations that you're seeing in the posterior lesion. Somewhat heterogeneous too in terms of their homogeneity. When we utilize elastography for this clinical case, you can see a fully hard or blue stiff pattern throughout both lesions. Great technique. We see good symmetry across the top and the bottom, as well as a full quality indicator. And so this is the classic finding In this particular clinical case, this was documented as papillary carcinoma. But where it can be really helpful is when doctors have to decide between following up a lesion or doing a core biopsy to get sufficient tissue to make a diagnosis by looking at that underneath a microscope. In this next clinical case, this is an excellent example of how fluid looks when we perform manual compression or strain elastography. So looking at the 2D image, we have an anechoic structure, which fluid is always anechoic on ultrasound, especially when it's a simple cyst. And then we have the through transmission or brightness posterior to it and some edge shadows from the edges of that structure. When we apply elastography to this with a manual compression, the system calculates stress versus strain, and in fluid we get this classic 3-layer pattern: blue, then green, then red. And again, great technique, uniform across the top and bottom, and a full quality indicator. So this can be very valuable if a physician is trying to decide whether to core or do a fine needle aspiration. If you know it's fluid, you're probably going to want to go in with a small needle to drain the fluid, alleviate the tension or pressure that comes from this, and then the symptoms of pain will most times go away. If you went after a fluid-filled structure with a core biopsy needle, you may pop the cystic structure, the fluid may leak out, and you would never get any fluid or cellular information from that. So again, knowing this is fluid is going to help your clinicians make a decision about how they're going to approach the invasive procedure. Another excellent clinical example, we have 2 anechoic structures, one on top of the other, and it's very important to evaluate everything in terms of maybe just because this structure looks cystic, this one may not be. But when we perform the elastography, you can see you get the 3-layer pattern in the large structure as well as the smaller structure, letting the clinician know they're dealing with fluid-filled structures rather than a solid mass. In the next clinical case, this is a great demonstration of using multiple technologies that we have on the Logic E9. We took the MRI DICOM data set and loaded it onto the ultrasound system. This can be done utilizing query retrieve, a USB, or a CD. Once the plane is locked, we mark 2 common points between the ultrasound and the MR, and the images are fused. You can see on the MR, the gadolinium is taken up in the neovascularity or the small vessels of lesions. We then apply elastography to this, and the elastogram is letting us know that this lesion is very hard or stiff in comparison to the surrounding tissue. So great example of a combination of technologies and also a very good technique. Another example where when we're looking at the 2D image, we see something very suspicious for malignancy. Mildly to markedly hypoechoic. We get some shadowing posterior. The borders of the lesion are very irregular, angular. We see some spiculations, some extension up the Cooper's ligaments, very irregular borders, heterogeneous in its nature. When we apply the elastography, we see this fully hard, blue or stiff lesion. Again, great technique and full quality bar. Another example where we're taking an MR data set, loading it onto the system, marking 2 common points in a plane and fusing the MR with ultrasound, and then applying elastography. And we can see again, we get that tri-layer pattern, so we know we're dealing with something that is fluid-filled. Last example, we have on ultrasound, kind of a isoechoic in terms of its echogenicity, so medium level gray, the fat layer here, but a little bit heterogeneous. Looks like there's little areas that are more hypoechoic than the surrounding tissue. Borders are somewhat irregular, And when we apply elastography, we can see good technique, symmetry across the top and bottom, good full quality index, quality indicator, and mostly mostly green with a couple little flecks of blue, mostly green throughout with a couple little flecks of blue, showing us that this is very similar to the surrounding tissue. And again, when we have lesions in the breast that are very compressible like this, we think about benign structures like fibroadenomas.